Bismillahirrahmanirrahim. Assalamu alaikum viewers. Dr. Zafir with you, and you are watching my informative vlog on Facebook and YouTube channel. When you have a baby, occasional infections and fevers may be inevitable. But even parents who have experience with sick babies can have trouble distinguishing between normal fussiness and mild illness from serious problems. Now I am here to suggest you when to contact your healthcare provider and when to seek emergency care for a sick baby. An occasional illness is usually nothing to worry about in an otherwise healthy baby, but sometimes it's best to contact your healthcare provider. I am addressing to the parents. Look for these signs and symptoms. Changes in appetite. If your baby refuses several feedings in a row or eats poorly, contact your healthcare provider. Changes in behavior. If your baby is usually sleepy or hard to awaken, tell your healthcare provider right away. Let your healthcare provider know if your baby seems floppy or if your baby is crying more than usual or is very hard to console. Tender navel or penis. Contact your healthcare provider if your baby's umbilical area or penis suddenly becomes red or starts to ooze bleed. Fever. If your baby is younger than 3 months, this is very important because it is the age dependent. If your baby is younger than 3 months old, contact your healthcare provider for any fever. If your baby is 3 to 6 months old and has a temperature up to 102 degrees Fahrenheit, that is 38.9 degrees centigrade, and seems sick or has a temperature higher than 102 Fahrenheit, that is 38.9 degrees centigrade or higher, contact your healthcare provider. If your baby is 6 to 24 months old and has a temperature higher than 102 Fahrenheit that lasts longer than 1 day but shows no other signs symptoms, contact your healthcare provider. If your baby also has other signs or symptoms such as a cold, cough or diarrhea, you might contact your healthcare provider sooner based on their severity. If your baby has a fever that lasts for more than 3 days, contact your healthcare provider. Diarrhea. Contact your healthcare provider if your baby has more than 3 stools that are especially loose or watery. Vomiting. Occasional spitting up. The easy flow of a baby's stomach contents through his or her mouth is not. Vomiting occurs when the flow is forceful, shooting out inches rather than dribbling from the mouth. Contact your healthcare provider if your baby vomits forcefully after feedings or your baby hasn't been able to keep liquids down for 8 hours. Dehydration. Contact your healthcare provider if your baby cries with fewer tears, has significantly fewer wet diapers or has a dry mouth. Also contact your healthcare provider if your baby's soft spot on the head, that is anterior fontanelle, appears sunken. Constipation. If your baby has fewer bowel movements than usual for a few days and appears to be struggling or uncomfortable, contact your healthcare provider. If you think your baby is constipated and your baby is vomiting or has a distended abdomen, call your healthcare provider. Colds. Contact your healthcare provider if your baby has a cold that interferes with his or her breathing, has symptoms that last longer than 10 days, has ear pain or has a cough that lasts more than a week. Grunting. If your baby is grunting with every breath, has a fever or appears to be in distress, then you must see the doctor. Now you can watch a short clip of baby who is grunting.
This grunting may be a sign of a more serious respiratory problem and needs immediate attention.
Rash. Contact your healthcare provider if a rash appears infected or if your baby suddenly develops an unexplained rash, especially if it is accompanied by a fever. Eye discharge. If one or both of your baby's eyes are red, swollen, or leaking mucus, contact your healthcare provider. If you are worried about your baby's symptoms, don't hesitate to call your healthcare provider or contact your doctor. We, the pediatricians, believe a mother is always right unless proved otherwise. If your baby is crying for no reason, then try this trick of holding the baby. Please watch this clip, and this is very useful when a baby is crying just for nothing and just making fuss.
We are your nurse for today.
This is nice handsome boy. Look at
Our baby little angel. He's not crying.
Good morning, sister.
Morning, doctor. Fine,
Morning.
doctor.
How is this baby doing?
The baby's
Good.
fine.
Now, today I will show you the trick how to make baby stop crying.
Okay, doc.
Whenever the baby is crying, first you just see whether he is hungry, diaper is wet,
Yes.
or he is having some abdominal colic, or he wants to be cuddled simply.
Okay.
But if he is crying for no reason, then you hold your baby like this, and hold with your left hand both arms and hands together like this, and chin together, all this, and put your right hand at the bottom, right, and this rock this baby like this, yeah? From down up, 30 seconds, the baby will stop crying. Again, if it starts crying, you can just rock it. So this is called magic trick, how to make baby stop crying.
Okay.
Okay?
So that
You
we
will
can teach the
remember?
mother
Yeah.
also the magic.
So you can teach the mother also in this way. Okay, right? Thank you, Sister Sonia. Thank you very
Thank
much.
you, doc.
Thanks for watching my informative vlog on YouTube channel. If you like this video, please subscribe and share.